Have you ever started taking a blood pressure medication only to notice that a few weeks later something just didn't feel quite right? Maybe you began feeling more tired than usual. Perhaps your ankles seemed a little more swollen by the end of the day, or you developed a dry cough that wouldn't go away. You might have wondered if it was simply part of getting older, or if it could somehow be related to your medication. If you've ever had those thoughts, you're certainly not alone. Millions of adults over 50 take medications like Amlodipine, Losartan, or Lisinopril every day. And for most people, these medications are very effective at lowering blood pressure and reducing the risk of heart attack, stroke, and kidney disease. But understanding how they work and what changes you should pay attention to can help you have better conversations with your healthcare provider and get the greatest benefit from your treatment. Here's something many people don't realize. Feeling different after starting a medication doesn't automatically mean the medicine is harming you, and it doesn't mean you should stop taking it. In fact, many symptoms people blame on blood pressure medicine have completely different causes, while some medication-related side effects can often be managed by adjusting the dose or switching to another medication under a clinician's guidance. Later in this video, I'll explain one of the biggest mistakes older adults make after noticing a possible side effect and why avoiding that mistake may be one of the smartest things you can do for your heart. Welcome back. If this is your first time here, I'm glad you're here. This channel is dedicated to helping adults over 50 better understand their health through practical, evidence-based information that you can discuss with your healthcare provider. Healthy aging isn't about fearing medications or believing every alarming headline you read online. It's about understanding your body, asking informed questions, and making decisions based on reliable information. Let's begin with something we all know. High blood pressure often doesn't cause obvious symptoms. That's why it's frequently called the silent condition. You can feel completely fine while elevated blood pressure is quietly placing extra strain on your heart, brain, kidneys, and blood vessels. That's also why medications that lower blood pressure have helped save countless lives by reducing the risk of strokes, heart attacks, heart failure, and kidney damage. Even though amlodipine, Losartan, and Lisinopril are all prescribed to lower blood pressure, they don't work in exactly the same way. Amlodipine belongs to a group called calcium channel blockers. It helps relax and widen blood vessels, allowing blood to flow more easily. Losartan belongs to a class called angiotensin receptor blockers, often called ARBs. It blocks the action of a hormone that causes blood vessels to tighten. Lisinopril belongs to another class known as ACE inhibitors. It also affects the same hormone system, but through a different mechanism. The goal of all three medications is similar, helping reduce blood pressure and protecting important organs over the long term. One of the most common concerns people taking amlodipine notice is swelling around the ankles or feet. This can happen because widening certain blood vessels may allow more fluid to collect in the lower legs, particularly after standing or sitting for long periods. For some people, the swelling is mild, while for others it can become bothersome. If you notice new or worsening swelling after starting amlodipine, don't simply assume it's old age. It's worth discussing with your healthcare provider because sometimes adjusting the dose, changing medications, or adding another treatment can help. Just as importantly, swelling can have many other causes, including heart, kidney, or vein problems, so it deserves proper evaluation. Lisinopril is well known for another possible side effect that surprises many people, a persistent dry cough. This cough often isn't accompanied by a fever or mucus, and it may linger for weeks or even months. Not everyone experiences it, but if it develops after starting an ACE inhibitor, your healthcare provider may consider whether the medication is contributing. In many cases, another medication from a different class may be appropriate, but that's a decision to make together with the clinician managing your care. Losartan is generally well tolerated, but like many blood pressure medications, it may occasionally contribute to dizziness, especially when first starting treatment or after increasing the dose. Sometimes the medicine isn't causing a problem at all. Instead, the blood pressure is simply improved, and your body needs a little time to adjust to the new, healthier level. That's one reason healthcare providers often recommend standing up slowly from a chair or bed during the first few days after beginning treatment. I'd like to ask you something because so many people have different experiences with blood pressure medication. If you take medicine for high blood pressure, how long have you been taking it? A few months? Several years? More than 10 years? Share your experience in the comments if you're comfortable. Someone reading your story may realize they're not alone in the questions they've been asking. Here's something else that's important to remember. Many adults begin a new medication at the same time that they're experiencing other changes in life. They may be sleeping less, exercising less, feeling more stress, or developing an unrelated health condition. It's very easy to assume the medication is responsible for every new symptom. Sometimes that's true, but often it isn't. That's why healthcare providers look at the whole picture instead of focusing on just one symptom in isolation. As you start paying closer attention to how your body responds, you may notice patterns that are worth discussing during your next appointment. Maybe your dizziness only occurs when you stand up quickly. Perhaps your swelling becomes worse after sitting all day, or maybe your cough appears only at night. Those details can help your healthcare provider determine whether the medication is involved or whether another explanation is more likely. We're only getting started because of the next part. We'll discuss several other changes that people commonly notice while taking blood pressure medications, explain the biggest mistake many seniors make after reading alarming information online, and reveal the simple daily habit I mentioned earlier that can help both you and your healthcare provider know whether your treatment is working as intended while helping keep your heart and blood vessels protected for years to come. One of the biggest mistakes people make after starting a blood pressure medication is searching the internet, finding a long list of possible side effects, and then assuming every ache, pain, or unusual feeling must be caused by the medicine. It's completely understandable. When you notice something different, your mind naturally looks for an explanation. But here's what healthcare professionals know from years of experience. Many symptoms have more than one possible cause. Fatigue could be related to poor sleep, anemia, thyroid problems, dehydration, or even stress. Swollen legs could be linked to vein problems, heart conditions, or medications. A cough could be caused by allergies, acid reflux, a lingering viral infection, or, in some cases, an ACE inhibitor like Lisinopril. That's why it's so important not to jump to conclusions before speaking with the healthcare professional who knows your medical history. Speaking of potassium, this is another area where many people become confused. Certain blood pressure medications, including Lisinopril and Losartan, can increase potassium levels in some individuals. Potassium is an essential mineral that helps your muscles and heart function properly, but like many things in medicine, balance matters. Too little isn't healthy, and too much isn't healthy either. That's one reason why it's important not to start potassium supplements or salt substitutes containing potassium unless your healthcare provider recommends them. Something that seems harmless at the grocery store may not be appropriate for everyone taking these medications. Let's also talk about dehydration because it's surprisingly common among adults over 60. As we age, our sense of thirst often becomes less noticeable during hot weather after vomiting or diarrhea, or when you're not drinking enough fluids. Dehydration can develop more easily. If you're taking blood pressure medication while dehydrated, you may feel lightheaded or dizzy, especially when standing up quickly. This doesn't necessarily mean your medication is wrong. It may simply mean your body needs fluids or that you should speak with your healthcare provider about what to do during illnesses that cause significant fluid loss. Now, I'd like to ask you something because your experience may help someone else watching this video. Do you check your blood pressure at home? Or do you rely only on readings taken at your doctor's office? Let us know in the comments. Many viewers discover practical ideas from reading each other's experiences, and your answer might encourage someone to begin monitoring their blood pressure more consistently. This brings us to the simple daily habit I mentioned earlier. Keeping a blood pressure diary can be incredibly valuable. Choose a reliable home blood pressure monitor if your healthcare provider recommends one. Measure your blood pressure at about the same times each day, following the instructions you've been given. Sit quietly for several minutes beforehand. Keep your feet flat on the floor, support your arm at heart level, and avoid measuring immediately after exercise, smoking, or caffeine when possible. Write down the numbers along with any symptoms you notice, such as dizziness, headaches, or swelling, over several days or weeks. These records can reveal patterns that a single reading in a clinic simply cannot. Many people experience what is commonly called white coat hypertension, where blood pressure is higher in a medical setting because of anxiety or stress. Others experience the opposite, with blood pressure that appears normal during appointments, but is elevated at home. Home monitoring, when done correctly and interpreted by your healthcare provider, can provide a much clearer understanding of what's happening in your everyday life. It's also worth remembering that medication is only one part of managing blood pressure. Healthy eating, regular physical activity, limiting excess sodium, getting enough sleep, managing stress, maintaining a healthy weight when appropriate, and avoiding tobacco all work together with medication to support heart health. Think of it like building a sturdy house. Medication is one important support beam, but it isn't the entire structure. Every healthy habit strengthens the foundation. Another mistake some people make is stopping their medication as soon as their blood pressure improves. It's easy to think, my numbers are normal now, so I don't need these pills anymore. In many cases, the reason those numbers are normal is because the treatment is working. Stopping medication without medical guidance can allow blood pressure to rise again, often without causing symptoms until damage has already occurred. If you ever feel your medication isn't right for you, the safest approach is to discuss it with your healthcare provider rather than making changes on your own. The encouraging news is that millions of people take medications like Amlodipine, Losartan, or Lisinopril for many years with excellent results when combined with regular medical follow-up and healthy lifestyle habits. These treatments have helped reduce the risk of heart attacks, strokes, heart failure, and kidney disease for countless individuals. The goal isn't to fear medication, it's to understand it, use it wisely, and work closely with your healthcare team to find the treatment plan that fits your unique needs. In the final part of this video, we'll bring everything together, discuss when symptoms should prompt an urgent call to your healthcare provider, explain how to get the greatest benefit from your treatment over the long term, and leave you with a simple action plan that can help you feel more confident about managing your blood pressure and protecting your heart for years to come.